Kidney disease is sneaky and deadly. It's now one of the fastest rising causes of death worldwide. What's worse, around 90% of people who have kidney problems don't even know it. But not you. In this video, we're breaking down 8 strange warning signs your kidneys might be struggling. And at the end, we'll share a few easy ways to keep them happy and healthy. Your kidneys sit quietly on either side of your lower back, working 24/7 like high-tech filters. They flush out waste, balance your body's minerals like calcium and sodium, regulate blood pressure, and even activate vitamin D so your bones stay strong. Oh, and they're also responsible for producing red blood cells by keeping your hemoglobin in check. So yeah, they're kind of a big deal. But here's the kicker. Kidney problems often hide in plain sight. By the time obvious symptoms appear, as much as 80% of the damage is already done. That's why spotting the early unusual signs is key. Some might seem unrelated or even harmless, but they could be your kidneys waving a red flag. So what should you watch for? Let's dive into 8 surprisingly strange symptoms that could mean your kidneys are crying out for help. And stay tuned till the end. We'll also share simple habits that can protect your kidneys and keep them running strong for years to come. Sign number 1. Puffy eyes and swollen ankles. Waking up with puffy eyes? Ankles mysteriously ballooning by the evening? That kind of swelling isn't just annoying, it could be your kidneys waving a red flag. When your kidneys aren't doing their job properly, they can't flush out excess fluids and sodium from your system. The result? That fluid starts pooling in your tissues, especially in the lower parts of your body like your feet, ankles, legs, and even hands. And thanks to gravity, it's the legs that usually swell first. But here's the twist. Swelling, also known as edema, isn't always just about the kidneys. It can also point to problems with your heart, liver, or even chronic vein issues. Low levels of a protein called albumin, produced in the liver and filtered by the kidneys, can worsen this swelling, making things even trickier to pinpoint. So what should you do? If you're noticing recurring puffiness or swelling, especially if it sticks around without explanation, don't brush it off. It's time to dig deeper. Your body could be trying to tell you that your kidneys need help. Sign number 2. Strange urine. Let's talk about something most people don't, but should: your urine. Because when your kidneys are struggling, your pee is often the first to sound the alarm. On average, we hit the bathroom 6 to 10 times a day. But if you're suddenly going way more or barely at all, or if you're waking up multiple times a night just to pee, that's not normal. And it might not just be about drinking too much water or aging. Sometimes you may feel an urgent need to go, but when you try, almost nothing comes out. That frustrating sensation could mean a kidney stone is blocking your urinary tract. Yep, it hurts, and it's your body's way of telling you something's off. Now let's talk about what's in the urine, because both blood and foam are big warning signs. Bloody urine, aka hematuria, might show up red, brown, or even purple. That discoloration could be due to a kidney infection, stones, tumors, or even kidney failure. For women, it's easy to confuse this with a menstrual issue, but if the timing is off or it seems unusual, don't dismiss it. Foamy or bubbly urine. That's not just a quirk. Persistent foam, especially if it looks like the froth on whisked eggs, could mean protein is leaking into your urine. That's a sign your kidney filters are damaged. One protein that slips out early is albumin, the same stuff found in eggs. And it has no business being in your pee. In short, your kidneys make urine. So when they're in trouble, your urine changes in color, texture, frequency, or volume. Listen to it. Look at it. Don't flush away the warning signs. Sign number 3. Persistent fatigue and low energy. Everyone feels tired now and then. But if you're constantly running on empty, even after a full night's sleep, it might be more than just a busy week or poor diet. Your kidneys could be struggling. Here's why. Your kidneys are your body's natural detox crew. They filter out waste, toxins, and excess fluids from your blood. But when they start to malfunction, those impurities build up, and that toxic overload can leave you feeling sluggish, foggy, and just off. But that's not all. Your kidneys also produce a hormone called erythropoietin, or EPO for short, which tells your body to make red blood cells. And red blood cells are the oxygen delivery service for your entire body. When EPO levels drop, fewer red blood cells are made. Less oxygen reaches your muscles, brain, and organs, and your energy tanks. This is why people with early kidney problems often feel weak, even after resting, dizzy or lightheaded, mentally foggy or unfocused, drained by everyday tasks like showering or walking across the room. Doctors say that when fatigue is kidney-related, it feels different. It's deeper, more persistent, and harder to shake. This is also when anemia, low red blood cell count, often begins to set in. Of course, fatigue can have many causes: stress, diet, thyroid issues, and more. But if you're feeling chronically wiped out for no obvious reason, it's smart to get your blood tested. You might uncover a kidney issue before it becomes serious. Sign number 4. Dry, itchy skin. We all get the occasional itch. Maybe it's dry weather, maybe it's soap. But if your skin constantly feels dry, flaky, or unbearably itchy, especially when nothing seems to help, your kidneys might be the hidden cause. Here's the science behind it. Your kidneys do a lot more than just filter toxins. They also help balance minerals in your blood like calcium and phosphorus, which are essential for healthy bones and skin. When the kidneys start to fail, that balance gets thrown off and your skin pays the price. What's more, if your kidneys can't filter waste properly, toxins start to build up in your bloodstream, and your skin tries to deal with the overload. That can trigger intense, sometimes localized itching, or even a spreading rash. In more advanced cases, skin tone might change too, becoming grayish, yellowish, or patchy due to internal toxicity. And here's the surprising part. In about 1 in 10 kidney disease cases, people actually get diagnosed at the dermatologist's office, not by a kidney specialist. So if you've been battling dry, itchy skin that just won't quit, even after changing lotions, soaps, diets, or medications, don't just treat the symptoms. Look deeper. It could be your kidneys sending out an SOS. Sign number 5. Shortness of breath. Most people chalk up shortness of breath to heart or lung issues, and often that's true. But here's something most don't realize. Your kidneys can also be behind that breathless feeling. When your kidneys aren't filtering properly, excess fluid and waste don't just hang out in your bloodstream, they can leak into your lungs. Imagine trying to breathe deeply while your lungs are being slowly filled with water. That's why some people with kidney issues feel like they just can't catch their breath, even while resting. On top of that, failing kidneys often mean fewer red blood cells, which means less oxygen getting to your muscles and tissues. That can leave you winded after even the lightest activities, like climbing stairs or walking across a room. And here's where things get scary. In more advanced cases, people say lying down feels like drowning. The fluid buildup in the lungs can make each breath feel labored, like you're gasping for air. That's not a symptom to sleep on. If you're feeling unusually breathless, especially when lying flat, or if your breathlessness comes with swelling or fatigue, don't wait. It's time to check in with your doctor. Your lungs might be trying to do the kidney's job, and that's not what they were built for. Sign number 6. Bad breath and metal taste. Ever taken a bite of your favorite meal only to find it tastes off? Or notice that no matter how much you brush or rinse, your breath still smells bad? If so, your mouth could be revealing a deeper issue with your kidneys. When your kidneys aren't filtering waste the way they should, toxins build up in your blood, a condition called uremia. These toxins don't just stay silent in your system, they rise up and make their way to your mouth. Here's what that can look like. A metallic or ammonia-like taste in your mouth. Chronic bad breath that doesn't go away with mints or mouthwash. Loss of appetite because food just doesn't smell or taste right. In more severe cases, nausea, gagging, or even vomiting, especially at the thought of food. People with this symptom often say it feels like their body is rejecting meals, even when they're hungry. That's a red flag you can't afford to ignore. If the thought of eating turns your stomach or your favorite dishes suddenly taste like metal, it's not just your taste buds acting up. It could be your kidneys crying for help. Sign number 7. Muscle cramps and twitching. Ever had those sudden, painful muscle cramps or annoying twitches that just won't quit? While they might seem harmless or just part of getting older, they could be your kidneys trying to get your attention. Your kidneys play a crucial role in balancing minerals like potassium, calcium, and phosphorus in your blood. When kidney function drops, this delicate mineral balance gets thrown off, and that's when muscles start to misbehave. Low calcium or high phosphorus levels can cause muscles to spasm, cramp, or twitch without warning. You might feel this in your legs, arms, or even around your eyes. These cramps often come at night or after physical activity, and no matter how much water you drink or how well you stretch, they just keep coming back. If muscle cramps and twitches are becoming a regular part of your life, especially alongside other symptoms we've covered, it's a strong sign to get your kidneys checked. Sign number 8. Sleepless nights. Can't seem to fall asleep. Or maybe you're waking up more tired than when you went to bed. Before you blame stress or caffeine, take a moment to consider your kidneys. When your kidneys aren't working like they should, toxins start building up in your blood instead of being filtered out. And guess what? That toxic overload doesn't just affect your body. It interferes with your brain and disrupts your ability to get restful sleep. But there's more. Kidney issues are also linked to sleep apnea, a disorder where your breathing repeatedly stops and starts during the night. This can cause loud snoring, gasping for air, and restless tossing and turning. Some people don't even realize they have it. They just know they wake up feeling exhausted no matter how early they went to bed. Sleep apnea is more than annoying. It's dangerous. It robs your body of oxygen and puts extra strain on your heart while worsening the cycle of kidney damage. So if your nights are filled with sleepless frustration, frequent waking, or you've been told you snore like a freight train, it might be time to look beyond your pillow and start checking your kidneys. How to take care of your kidneys. Taking care of your kidneys isn't complicated, but it's absolutely essential. These little organs work tirelessly behind the scenes to keep you healthy. So here's how to show them some love. 1. Stay hydrated. The simple but powerful fix. Water is your kidney's best friend. Dehydration is one of the biggest causes of kidney stones and infections. Aim to drink at least 4 to 6 glasses of water a day to keep those filters running smoothly. Bonus tip: sipping on warm or hot water can actually boost kidney function. In one study, kidney patients who drank a liter of hot water in just 30 minutes saw a noticeable drop in harmful waste levels, a game changer. 2. Be mindful of medications. Some common meds like ibuprofen, naproxen, and other anti-inflammatory drugs can stress your kidneys if taken too often. And antibiotics. They're powerful fighters against infection, but they also come with toxins that force your kidneys into overdrive. If you have kidney issues or are at risk, always chat with your doctor before taking antibiotics like penicillin or sulfonamides. Your kidneys will thank you. 3. Move your body. Every day counts. Exercise isn't just good for your heart and waistline. It's a major win for your kidneys too. Keeping active helps maintain healthy blood pressure, which takes a huge load off your kidneys. Whether it's walking, swimming, cycling, or dancing around your living room, find what you love and do it regularly. Your kidneys will feel the benefits for years to come. 4. Know your risk. Get checked. If you're over 60, were born with low birth weight, or have a family history of heart or kidney disease, don't wait to get your kidney function tested regularly. Early detection is your best defense against serious complications down the road. Remember, your kidneys are nature's superpowered detox system, quietly working 24/7. They often go unnoticed until something goes wrong. But once kidney damage sets in, reversing it can be tough. That's why spotting symptoms early and making healthy choices now can save you a lot of trouble later. If you found this video helpful, please like and subscribe for more health tips. Share this with friends and family. Let's help everyone keep their kidneys in top shape. Catch you next time, and here's to healthier kidneys and a happier you.